Thank you for joining us for an informative discussion on COVID-19 with Guthrie, Magic FM, and WYDC TV, Big Fox. I'm your host, Frank Acom. Please join me in welcoming our expert panel from Guthrie. If you could please introduce yourselves and tell us your role at Guthrie.
My name is Dr. Danielle Terry, and I'm a clinical health psychologist and the Director of Behavioral Science for Guthrie Family Medicine.
And I'm Dr. Michael Scalzone. I'm Executive Vice President and Chief Quality Officer for the Guthrie Clinic.
And I'm Philip Hebner. I'm the Assistant Chief of Pediatrics for Guthrie Medical Group.
So one of the major concerns that you hear from people day to day is how they deal with kind of the stress and anxiety from this crisis. What are some of the recommendations that you have so people can get through this mentally sound?
Absolutely. I think that it's a very stressful time, and so one of the first things to recognize is that during any time of distress, any time of crisis or major change or threat to one's environment, they are going to be distressed, and they may feel a lot of stress, and that's very, very normal to have that reaction. There are a number of ways that they can help themselves. I think primarily, one of the phrases I always like is the idea of going back to basics. And what I mean by that is sleep the best that you can on a regular sleep cycle. Do the best you can with eating as healthy as you can. Get out and get a little bit of exercise. Do activities that you enjoy and have some sort of routine throughout your day, especially when you've experienced maybe work changes, lifestyle changes. Many people have school systems that are out, so they're homeschooling their kids. So there's a lot of things that have happened there. Also, avoiding excessive use of alcohol and other drugs can be important during this time, and we know that caffeine can increase feelings of anxiety and those jitters, so also making sure that you don't overuse caffeine during this time.
And as you mentioned, a lot of schools are out and parents are homeschooling. What would you say to the parents or guardians that have to deal with their child who probably has anxiety issues at this point?
Well, that can be a challenge. I think the first thing that parents and guardians and caregivers need to do for the children around them is to manage their own anxiety and distress. That's extremely important. So they need to start by helping themselves. But also, it's very important for children to have a routine. So that's going to help you. That's also going to help your child having a regular daily routine. And also talking to them in ways that they can understand about COVID-19. And making sure that you limit media exposure and media use. There's a lot of things out there. There's tons of people talking about this. There's a lot of things on the computer, on the TV, and so on and so forth. So making sure that you limit the amount that children are exposed to these things, and they may misunderstand some of it. So you're really going to want to take time to help them understand that better.
Do you have any resources that you recommend for those that are currently struggling?
For folks who are extremely distressed and are experiencing emotional side effects as a result of COVID-19, there is a national hotline, the Disaster Distress Hotline, and you can contact those folks. They are experienced crisis counselors that you can reach out to at 1-800-985-5990. There are also, if someone needed resources psychologically, there are real-time updates happening on psychologytoday.com where they're listing therapists who have access to telehealth services, so that's also something that you could do. And anybody else who's just experiencing general distress, I would recommend setting up a virtual visit with your primary care provider. They probably are going to be able to point you in the direction of resources, and probably there's someone who can support you and help you in this time of distress.
Can we talk a little bit about what you had just touched on, this telemedicine and being able to see a doctor without actually having to see a doctor? When do you recommend that?
So telemedicine is something we've been doing for a while, but we've really stepped up with the obvious need. And we have over 400 providers, doctors and advanced practice providers, who are skilled in telemedicine and are available now for appointments. So really it is both for primary care and for specialty care. And I think in the context of pediatrics, which is my focus, there really has been a national statement from the American Academy of Pediatrics recommending that we continue visits for children 2 and under for their scheduled well visits, both so they can get their needed immunizations, but can also have their growth and other conditions monitored. So those are visits that we really will continue to need to do in person, but pretty much everything else is a good candidate for telemedicine visits, be it a medicine recheck or a mental health check where you have some questions about how things are going on with your children or adolescents. The number to call is 866-488-4743 if you don't already have an eGuthrie account. But if you do have an eGuthrie account, you can access us directly by requesting an appointment that way, and we get back to you in a timely fashion.
Do you have specific recommendations for parents during these times?
Yeah, it's be flexible, be positive. It's okay to have to repeat yourself to reassure your children. That's very normal. I think the school-age children especially are fairly concrete thinkers. They don't think abstractly and long-term about things, so they may ask the same difficult question about what's going on day after day, and they really need to hear some positive feedback on a regular basis. So it's difficult to be patient, but it's really important to be patient. So that's the best advice, is one day at a time.
I'd like to add one point to what Dr. Hebner said, very importantly. He said that the office remains open, and we do want to make sure that people realize that our offices are safe places to come to get the care that's needed. When this initially began, everyone was very concerned about coming to the physician's office, and that's very understandable. But we put a lot of things in place to make sure that they're safe. We separate patients that may be ill from those that are not acutely ill. There are distancing guidelines and masks that are used. So we just want to remind folks, your physician's offices are safe places to go and not to delay important care that's needed.
And that should also, maybe piggybacking on that, talk about coverage if you use telemedicine. Could you explain that? Are people covered by Medicare, Medicaid?
Yes, they are. So there were provisions to some degree before this, but since the beginning of March, both Medicare, Medicaid, and most third-party insurers are not charging their patients any copays, and we're not collecting any copays relative to telemedicine visits. So the access should be easy from that standpoint.
And just to reiterate the point, could you tell us again what patients, the variety of visits they're looking at for telemedicine?
Well, I think if a patient of any age really has any concerns, they should contact us to see what sort of visit might be most appropriate, and we can remind them of those patients that need to be seen in person for some solid reason, like they need vaccines or there's some physical component of the exam that's absolutely necessary. But I think just about any other kind of visit is potentially a telemedicine visit, and if that's not possible, we can advise otherwise. So I think anytime a patient has a question about whether it's appropriate or not, it's the right thing to call us and ask.
And you've all been worried about us, so let us be worried about you for a moment. Can you talk about Guthrie's COVID-19 response and how you've been prepared?
Well, we appreciate that. We appreciate that concern. We've spent a lot of time. The entire team has spent a lot of time preparing in two directions. First, of course, to take care of whatever patient needs there may be, and in order to do that, that's required an awful lot of people to do alternative kind of work, to come together in different groups and prepare for any surge of patients that may come. At the same time, there's been changes in the business that we are seeing, different sets of patients needing care or care that's been delayed for a few weeks. And so now large parts of our team are beginning to say that care that had been delayed safely for a couple weeks now needs to come in. Childhood immunizations and other things that perhaps for a couple weeks could have been delayed, but that not would be wise for several months. And so we have teams that are working in many directions to make sure that we're here and ready to take care of whatever patient needs there are.
And nationwide and statewide, we hear a lot about the lack of supplies, and especially for frontline staff. How are you guys when it comes to the supplies?
Well, thanks again for asking. We feel like we're in a very good place. Obviously, that has been a serious concern across the country and across the state, talked about nightly at the news and governor's addresses each day. But we feel like we've had some generous donations from the community. We've had some partners in the community that have just really stepped up, donating both money and equipment. And we have more than enough supplies to be able to take care of our current patient loads and any that we anticipate. So we feel very good about our supply currently.
Is there anything that we can do as a community to help you?
We're very grateful for all the help we've received, and we certainly would be open to whatever others would like to do. The best place to do that is we have a emergency response fund on our website at guthrie.org/help COVID-19. If you just go to our Guthrie website, you'll be able to find it quite easily, and we appreciate everything that people want to do for us.
Now let's talk about the key word lately has been flatten the curve. How, maybe you can stress the importance to us of this continued social distancing.
There are two parts of that are very important. The first was in attempting to slow the spread of the virus by flattening the curve. That allowed us as a healthcare system and other healthcare systems to be able to be prepared should that surge of patients arrive. And that has been effective. That has worked. I think, as we know, caseloads are changing over time, and we feel that very acute surge of patients that we worried about perhaps a few weeks ago is not as concerning right now. So that has been effective. And we know that it's difficult. It's very difficult to maintain this social isolation. It's very difficult to have our lives disrupted. Dr. Terry was talking about that earlier. The second part of that is it does help decrease the spread. And that's another aspect of this pandemic that's important, is how many people each infected person touches in their life and what that risk of spread is. So it actually has two impacts. One is to slow the spread, but also to decrease the number of individuals that actually contract the virus. And it's been very difficult, but nice to see that it's been helping.
And you're out in the community and you're dealing with this firsthand. Have you been encouraged by the people and how they are social distancing and trying to stay locked down?
I'll ask others to speak as well, but I've been incredibly impressed at how willing people have been to do that. It is very difficult, as we all know personally. It changes our life daily, but I've been really impressed at how people have been willing to do it. Dr. Terry?
I would agree. I think I've seen a lot of folks, and folks that I work with typically have pre-existing anxiety and depressive disorders. And so it's a really, really difficult thing to do, but people are doing it despite the cost to their mental health. And so they have to find innovative ways to communicate with each other. Luckily, we're a pretty technological world, so they're able to communicate with each other through things like video chats and emails and phone conversations. But yes, I think I've seen a lot of people doing it, and I am very encouraged by that.
Must be difficult for the kids.
Yeah, I think it's especially difficult for kids who don't really understand and don't have a lot of context. But I think older siblings and the ability to telecommunicate with grandparents and teachers and other mentors, it's been invaluable. And people have really stepped up to support children in this time. And of course they should, but doing it is another matter.
Did you ever imagine a time where we'd be told by everybody from the president to the governors to your local town officials to wash your hands?
Boy, I don't think I could have ever guessed that. It's a message we've been trying to talk about internally in healthcare for decades. And I think we're doing it better internally than we ever did before, and I think the community certainly is. But it's amazing how simple things can have a big impact. So please, let's everyone continue to wash our hands.
Right. On that, continuing to wash your hands, are there other precautions that we all should be taking during this pandemic?
I think, we talked about the biggest one, probably social distancing, but covering one's cough, washing one's hands, desanitizing areas that have had many people touch them. These are all going to continue to be important through the COVID pandemic and beyond. It helps to decrease the risk of influenza or other infectious disease. So I think there will be some positives that come out of this terrible situation, and hopefully one of them is we'll be a little more aware of the risk of catching certain diseases and perhaps not have that happen as often.
And I know there's been some questions about face masks because many areas are making it mandatory to wear face masks, like in New York. What masks should people be wearing, and what is the benefit to these masks?
Well, that's a great question, and there are a couple parts that are important. Part of it is important to understand that the science is imperfect. Just as with many aspects of COVID-19, the science is imperfect. But what we do know is there are some simple solutions that probably can help, and masking is one of those. It's important to recognize that the masking equipment we use in the hospital, what we consider to be surgical masks or respirators, they are designed in large part to protect the individuals who are wearing them, our healthcare workers. The cloth face coverings, the cloth masks that people are wearing are designed to protect someone else. And they probably do help to limit spread so that there's less spread of the virus from the person wearing the mask. It's effective of preventing the person wearing the mask from catching something. But is it a simple, somewhat inconvenient, but if it helps us to prevent more spread, then well worth doing.
Now, what kind of extra precautions have you been taking in essential areas in the hospitals like emergency rooms?
We do a number of things. First, everyone who comes is, of course, screened for questions about their contacts and have temperature screenings done. We have restricted visitation, as I think most institutions have, as mandated by the states. And then we use a different type of personal protective equipment in our emergency rooms when there's increased risk. So it's a stepwise progression of barriers, if you will, environmental barriers, based on where patients are moved, should they have symptoms of a possible COVID disease, or in the offices, having an area that's very clean and would not have any patients with symptoms versus those that could be at risk. So it's environmental versus personal protective, and then just general precautionary.
And maybe this is a good opportunity to circle back around and talk about telemedicine, because this is one way that, again, going back to social distancing, people, if you don't need to go, obviously you're saying if you need to go, go. But if you don't need to go, there is absolutely no sense. So could we reiterate telemedicine again?
Of course. So telemedicine is just another way of delivering care. And I think in this context, when we can safely and effectively deliver care, it's a great option. Naturally, with certain things like immunizations and well child care, or certain physical examination components that have to occur in other medical contexts, a person will need to be seen and be examined in a safe manner with all of the precautions we've been talking about. So again, I think we don't want to delay necessary medical care of any kind, but if we can facilitate that care by doing as much of it remotely as possible, well, that's probably the safest way. But we need to strike a balance between preventing other diseases that we don't want to see progress. Specifically, we don't want to see a resurgence of measles or anything like that, which is, it doesn't sound real, but it's very real. There are parts of the world that have suspended their measles vaccination campaigns for months, and that creates risk. So we want to protect our children and our families. We want to make sure people are getting the physical and mental health care that they need in a timely fashion. And telemedicine is a great alternative when either a physical examination really isn't necessary, or if people simply feel uncomfortable and fearful and they just need another avenue. I think it's something that we're doing very well.
And that phone number again, 866-488-4743 for a telemedicine appointment.
Yes, that's correct. And then also people who already have an Guthrie account can access it remotely from whatever device they have it set up on. I think that's very convenient as well.
This next question is really open to any of you. What would you recommend to a person that is concerned that they may have come in contact with COVID-19?
Well, I think the first thing to do is if you are fearful that you have been infected, you should self-quarantine. You should try not to spread the virus. Even though you may not be symptomatic, there's some increasing evidence that some of the spread, or a significant amount of the spread, is by asymptomatic individuals. So I think if you're not sure, you should take those initial measures to perhaps not affect people you care about in your family or your community, and then you should contact either the health department or your doctor's office for more advice. And I think that's the place to start and get some solid advice on what to do next in terms of being evaluated or tested.
And Dr. Terry, this question is for you. A lot of people are anxious right now and never really been through anything like this. What would you say to someone that's never had this high anxiety prior to this? What is your advice for them?
I think the first thing really is similar to what I had said before, which is realize that it's normal. It's healthy to have a distressed reaction to a stressful time. That's what helps us be more vigilant about doing things like washing our hands, engaging in social distancing. That's adaptive, and that's not necessarily a bad thing to be distressed right now. There is something to be distressed about. And so for those folks who haven't experienced this level, I would say realize that it's normal, realize that it's okay, and then do things that you would do to comfort yourself and to care for yourself, whatever those things might be. So, good eating, good sleeping, and engaging in pleasurable activities, limiting your media exposure and making sure you're seeking out resources that are healthy for you, and engaging in as much social contact as you can safely through video, through phone, through email, and so on.
And that's a really good point. I mean, we live in an amazing time where we can still be social even though we have to social distance.
Absolutely. It's very true. We can be very social still. We just have to realize that it might not be quite as satisfying as it usually would be, and that's okay. There's eventually, someday, we were going to get through this. And I think that's something to realize too, is that we will get through this. And right now, surrounding yourself virtually with the people that comfort you. When you have a bad day otherwise, who would you go to? Who would you talk to? Who would you seek out? And those are the people that you really want to seek out right now, not the people that end up distressing you more. So something to think about, just really surrounding yourself with people that you love and care about virtually.
And if I can learn Zoom, anybody can learn Zoom.
Correct. Yep. And if you can't learn Zoom, you can still talk on the phone. You can talk on the phone, you can send an email, you can send snail mail, although you want to be very careful about that as well. But maybe you have some stamps sitting at home in your drawer and you can set it in your mailbox. But thinking about other options like that as well.
And I know we talk about some of the same issues throughout this, but I think it's so important. We've talked about continuing to wash your hands, and you just mentioned with mail. You recommend wiping down packages and things like that to, again, keep ourselves safe?
Well, again, I'd say that the science is always difficult in situations like this. It's probably not something that you can say is proven to have benefit. Those types of surfaces probably don't carry the virus nearly as much as the droplets that are produced when someone coughs or sneezes. On the other hand, if you have wipes available and you can do that, it's certainly reasonable to be safe. But I would not have people worry too much about things like packages and groceries, but be smart about the other aspects of things. Wash your hands before and after, and I think that would be the safest way to describe what to do.
As we get ready to recap and end our informative discussion, I want to talk with each of you again to kind of stress some of the more important issues. First question, I know I brought it up earlier, but how can we as a community help you?
I would say
take care of yourselves.
Yeah.
Wash your hands, follow social distancing guidelines. The healthier our community is, the healthier we will be and the less risk we will have. So I think listening to experts and staying in touch with what the recommendations are and basically all of us behaving ourselves is the best policy.
And speaking of mental health, reaching out to those around us virtually. There are a lot of people who are isolated. There are a lot of people who are lonely. Most people, you look at parents who are struggling to manage homeschooling at home. Those are the people around us. Being kind to each other during this time, I think, can be very helpful, and just making sure the people you care and love are doing okay.
And I'd say it's important to realize that things are going to change. The recommendations are going to change. Eventually, the restrictions will be released a little bit. It'll be a little simpler. And so as that changes, so will recommendations potentially. So people just have to learn a little bit of that flexibility. There'll be anxiety associated with that, but that will be very important to be able to stay in touch with respected sources and listen to good advice as those social restrictions are relaxed a little bit.
Have you been encouraged by the outpouring from the community for all that you're doing? We hear so often just thank you. Thank you to what you guys are doing and all the people on the front line. That must feel pretty good.
Oh, it does. I've been doing this for almost 35 years, and this is without a doubt the most heartfelt thanks that I've seen from communities, from colleagues, from patients. Everybody's in this together, and it's really very heartwarming to see that genuine feeling of thanks. And we're grateful for everybody in the organization, all the hard work everyone is doing to prepare, those that are right on the front lines, taking care of patients who are ill, those that are taking care of the other folks that don't have COVID but still need care. It's really been remarkable coming together.
Before we go, is there anything that you individually would like to say to the community?
I think it's an important time to take care of each other and to take care of yourselves and to reach out to your provider when you need to and to do these things virtually, of course, but I think now's the time to be kind to each other and gracious and compassionate towards yourself.
And I'd like to thank all the generous community members from those organizations and companies that have donated their services or their equipment, have offered to do things to help us with personal protective equipment, from folks that have been sewing face coverings and masks at home to those donating their resources or their time to help out in this pandemic. It's just been wonderful to see that outpouring.
Yes, I would like to thank the families and the parents and the grandparents and the caregivers who are all going the extra mile to really take care of the kids, especially now that school and daycare is limited. It's a big challenge, but I think people are really stepping up. And I think it's very important to continue, as part of taking care of yourself, to get the medical care that you need, whether that's through telemedicine visits or if we communicate and we say it's really important to come in. I think you need to feel that that's a very safe alternative, and we're working very hard to ensure that. So please keep up with your medical needs, because your health is very important during this time.
Well, I'd like to thank each of you on our expert panel for being a part of this today. And I want to thank everyone at Guthrie, and I think I speak for everybody listening and everybody watching. Thank you for all that you're doing through this pandemic.
You're welcome.
Thank you.
Thank you.
Well, thank you for joining us on an informative discussion on COVID-19 with Guthrie, Magic FM, and WYDC TV Big Fox. Stay safe. Thank you.